So, welcome everyone to our sixth season of Obliquity. Caring is virtually everywhere. We are very excited to have Dr. John Grampol with us today. He is a clinician, teacher, and researcher in childhood cancer and palliative care for over 40 years. He co-directed bone marrow transplant units at Case Western University and the University of Florida, and co-founded the University of Florida's Center for Arts in Medicine. He also co-founded HARP, which is a publishing house dedicated to art and health that's published over 35 printed books and 18 ebooks. And he's written 13 books of fiction, nonfiction, and poetry. So without further ado, I'll pass it on over to Dr. Grampol.
Thank you very much for asking me, Manisha. I I have a confession to make. I've never been to Calgary. Isn't that awful to have missed such a wonderful experience? But I have been to most of the United States. I have three passports. As you can probably tell, I have a Southern accent, as I used to say to my friends in Florida, a Southern English accent. And mostly people can understand me. But if you have any trouble, I'll try to speak slowly. I probably won't cover all the grounds I'd like to cover. I've been looking at your wonderful website and all the ambition to process intense emotion and difficult situations, to dissolve the partition between the arts and sciences, and explore humanities and medicine. Those are lots of wonderful themes. I have a list here. I was just looking at what I wrote down as and I've got some notes. So if I'm not keeping eye contact all the time, forgive me. I'm looking at my notes. Um, what it says here, uh, what it said when I wrote this was a conversation about attention, creativity, observation, and care, healing words that doctors use too little. I hope that's not I'm not trying to reflect on doctors in any way, in any negative way, but I do think there are some, well, I want to have a conversation with you using some of those words and hopefully hearing from you. I know that the time is limited, but we can get a good start. Um, the words that I've actually got down here in my various scribbles are purpose, healing and holism, love, touch, that's a good one, illness and wellness, practice, masterful inactivity, that's another good one, art and heart. So those are words, and some of which I'll say something about and invite you to respond. Not a lecture, conversation, I do hope. I will say, as far as purpose is concerned, that I learned in medical school in London, England, that my primary purpose as a doctor was to cure illness and to save lives. But of course, we are all living and we are all dying. Life is a terminal condition. So saving every life and curing every illness can't obviously be our primary purpose. So to me, what gradually became apparent to me, what was my primary purpose, was to promote healing in whoever came into my care. And when I set out practicing pediatric oncology in the 60s, 1960s, Christ, that's a long time ago. Excuse me, that's a long time ago. I beg your pardon. 60 years ago, at least. My goodness. All my patients died, almost all. I would say maybe all. Isn't that something? All those children. But you know what? I did still use my intentions and my skills not only to try to achieve longer remissions in their cancers, but also, these are the important things. I hope that I spent enough time with them as witness. Witness is a lovely word which I could talk about a lot, but I'll stay with relationship, open and trusting relationship, and to relieve their physical and psychological suffering, perhaps even their spiritual suffering, to answer their hardest questions. One of the most challenging things, the word doctor means simply, anybody know what doctor means? Latin from doctor. What's the word mean? Frank, I see you down there. Oh, you're silenced. You're all silenced. Oh. Does anybody able to tell me what doctor means? Oh, well, it's quite simple. Docere is to teach. We are teachers, first of all. Education is perhaps the most important aspect of our jobs, really, educating. Can you hear me all right, by the way? I assume you can. You're silent, that's all. Everybody
Yes,
can.
we can.
Good. Okay. I'm all right so far. So, yeah. So to be witness, to build relationships, to relieve suffering, to answer the hard questions, to overcome what was inevitable distress in these young people and their parents, of course, as we all know, or at least as a pediatrician like Manisha, um, our job is at least as much the care of the parents or the family members of our patients. Of course, this is true of all patients, but I think with pediatrics it's particularly so. So I encouraged, because of the isolation of having a serious illness, I encouraged my patients to hang with other patients with similar illnesses. And you may say, well, could they? Weren't they in isolation? No, we broke a lot of rules. We didn't isolate our patients, not too much. Um, and so building relationships when you couldn't go to school, you couldn't have your normal friendships, but with fellow sufferers, that was a trick. That was a good way to help build some or break down some of the isolation. And of course, acceptance. To reach acceptance of an illness which may well kill you um, isn't an easy thing to do. It's an awful situation to have cancer when you're young. I can't say that I had cancer when I was young, but my mummy died of cancer when I was quite young. I was 12. And the thing about tragedy like that, and it was a tragedy, is that it can gradually appear to you that there's a reason for things like that. And indeed, I look back on my life that it was my mother, my mummy's death that took me into medicine. I wasn't exactly cut out for medicine. I was much more interested in the arts than sciences, I'll be honest. Um, well, there's no reason not to be honest. Anything I say is coming from the truth, I hope. Anyway, so that's about purpose. Now then, let me ask you, who's going to put their hand up? Like I can't see you now. I can see Elizabeth and I can see Heather. Heather, what would you say your purpose is right now? Are you, well, I'm sorry, I'm going to block up. I'm going to back up. Are you a medical student or a doctor or what are you?
I am
Heather?
the mother of a doctor.
Oh, good. Excellent. So
Yes.
what's your purpose? Or maybe,
Uh,
yeah, what's your primary purpose right now?
I think my primary purpose is to share my life journey of learning and living experiences
Uh-huh.
with with people to help them. Much like you mentioned, I have a health condition, and hanging with like-minded people with a health condition, yes, it does make a difference. But also hanging with typical people who don't have the illness is also a big gift as well. To be able to be with people who maybe they don't completely get it, but they can witness. That was such a powerful word that you used, because so I just think that my purpose is to allow people to witness um, my life my experiences for me to be able to help in any way I can for them.
Excellent. Thank you. This is great. Oh, good. We are having a conversation. Thank you very
Dr.
much. And thank
Granpole,
you.
I just wanted to add, if things get put in the chat, I will read them aloud. So Shane Nielsen has said, my purpose is to care for my children and to be with my wife, then to sing.
Excellent. Oh, to sing. Good. Excellent. Yeah, I'm not going to look at the chat, but thank you. And I'll be able to, I'm sure. Okay, my next word is healing, which I couple with holism because they are closely related. And I like the word healing because it's not used too much by doctors on the whole. It really means wholeness, coming from wholeness of body, mind, and spirit. So if your body is sick, that doesn't mean that your mind, your emotions, your spirit, your soul, if you will, need to be sick, if that's the right word. Holism shows up 80 times in PubMed. Oh, anybody know? Let's see. Anybody know what PubMed is? I'm sure you do. Somebody must. Yes. Elizabeth, what is PubMed? Just briefly, so we'll all understand, in case anybody's.
It's a publication database for medical related articles, mostly, I think, journal articles and other. I'm a psychiatrist specializing in chronic psychosis, if you're asking who we are.
Oh, good. Yes, I'm so glad to hear that. Wonderful. My goodness. Are there any medical students amongst us? I wonder. Yes, well, Kaylin's a medical student. Yeah, thank you for that, Elizabeth. Absolutely. And interestingly, so I said there are 80 that I found, 80 publications that used the word holism in PubMed, but PubMed's database is upwards of 40 million. So that's a pretty, I don't know what 80 or 40 million, but it's a pretty small number. And most of those words, most of those publications that included the word holism were from the nursing literature, the nursing. And I will say that one of the books I published was about learning from nurses. Because it took me, again, I only wrote it recently because I only really realized that I had learned a great deal from nurses. I'm telling you this particularly for young doctors and for medical students and anybody in healthcare, that nurses have a great deal to teach us as doctors. That's what I'll tell you about that. I could go on and on about all these things, but I want to say that that healing is an intransitive verb. Intransitive in the sense that we do not do the healing. If we are healthcare givers, we don't do the healing. It's the patient does the healing. And Benjamin Franklin actually put it this way: God does the healing, while the doctor takes the fee. Not bad, eh? I like that. And working in America, money was rather a divine thing, I suppose, that for many of us, to be honest. And I won't get into the money situation, but it is true that we don't do anyone who thinks that thinks of yourself as a healer, think of yourself as an agent to war and a witness, like as I said, it's a good word. Curing and healing are distinct concepts, although they can be used interchangeably, but they do have quite different meanings. Curing to me, and that is my rough definition, means eradicating a disease from a body, most often through drugs and surgery, and indeed, if you're dealing with psychosis, you get to see a psychiatrist, perhaps if you're lucky. I hope maybe we'd see Elizabeth. But it isn't about. But healing, on the other hand, is much more beyond bodily illness. In isolation, it offers us the chance to restore our well-being. It's a nice word, that well-being. It gets a bit overly used, but then so does Shakespeare. I often think if anybody says, "Well, God, that's a trite word that gets used so much," well, there's a reason for words that get used a great deal. I like it. So well-being and balance body, mind, spirit, I guess you would say, balance, including emotional, mental, spiritual health, all of which are very relevant to, and I'm sure I don't have to tell you this, but it seems like it's a good thing to remember that both curing and healing are essential and they're complements. Okay, let's see. Who wants to say something about healing or holism? Let's have a look. Alexandra, are you all women? Are there any men? Oh, there are men. But now I've been picked on you. I don't mean to pick on anybody. And if you don't want to say anything, it's absolutely fine. I understand that entirely. Silence is golden. I can't hear you because you're blocked. You're muted. You're still muted. Oh dear. Can you unmute?
There we go. I am also British.
Oh gosh, so you are.
Yes, I'm British, but I did go to medical school here. I'm a doctor of 30 years.
Oh my goodness.
And yes, I had cancer too. So my mission is healing in not just a physical sense, but in a psychological sense for breast cancer patients like me. And yes, I created a really novel clinic so that patients could get their final restoration tattoo, which I perfected. And the funny thing about this, what you're talking about, is yes, I'm creating this relationship with tattooists, and we think of ourselves as so high in medicine as doctors, but humility is the best way to learn. And I have learned so much from tattooists and created a relationship. So the harmony we're finding is actually something patients crave. They want closure, but they want a balance and a harmony at the end of their breast cancer. I believe that what I do actually not only extends their quality of life, but I actually believe that it probably extends their survivorship, like you were saying, because they are so profoundly changed by how they look and how they feel.
Good. Excellent. Thank you. My gosh, it's like you've prepared speeches. That's both of you. Oh, gosh, all three of you. Very eloquent indeed. Hi,
May I
Amelia.
read something out of the chat again? Sorry to interrupt.
Please do. Yeah, that's a good idea. It's fine.
From
3 seconds swallow.
From Chris, I'm profoundly convinced of the interconnectedness of all things, but frustrated by the fact that health systems and many health providers think and operate in silos, fundamentally disconnected from each other, from opportunities to support and learn from each other and their patients.
Thank you. Is that Chris Johnston?
Yes.
Hi, Chris Johnston. He or she is hiding. Okay, and hi, Amelia is not hiding. Hi. Are you a medical student? Are you a medical student, Emilia? Emilia, is that right?
No, actually, I'm an oral and maxillofacial surgeon,
Oh,
but I'm
gosh,
I haven't practiced in about 6 years almost now.
Oh,
Yeah.
okay. Well, it's good you're here. Are you planning to practice again?
No, I turn my attention towards topics like these.
Good.
Yeah.
This is a different group from what I expected. That's all right. That's wonderful. I'm not complaining. I can assure you this one. my next word, I'm going to try to get through these words, and it clearly is evoking some interest and comment. Love. How about that? Loving others, expressing this love, I believe is crucial word. Again, I didn't, oh, well, when I was in medical school, I never heard that word love. I would have been highly embarrassed to use it, I think. And yet, looking back, I realize that the reason I went into medicine was to try to cure cancer because of my mother's death, very untimely, in that I was just 12. I'd just been sent, I'll tell you, I'd just been sent away. Can you imagine this? This is England, and perhaps Alexandra can understand this, but I had just been sent away to a private school, boys only, boarding school, just been sent, and then I get called home to my uncle calls me home and says, "You've got to come home." And he tells me in 4 words, it was 4 words, it's, "Your mother died 3 days ago." That was it. And the next day I went back to school. And I had no idea what had killed her or anything else because he didn't tell me. He was a physician. It's very interesting, isn't it? That's England in 1954. But that's still, even today, seems to me to be not a very good way to handle it. Something like that. Anyway, love. We can get along for a good long time without being loved, but if we shut ourselves off from loving others, we'll be in trouble. I think expressing our love for others in our thoughts, in our work, and you can tell I'm reading because otherwise I'll just go off in all kinds of directions and we'll never be. How many hours do we have? 4, 3, 5, 6? Anyway, I'll try to keep going, and I don't know how we'll end this, but we'll just see how we do. Anyway, I would say that our vital purpose as caregivers, love and healing, feel to me very closely related. And as I said, I never heard that word used, I must say, but a while back, I'll show you. I think I can show you. Yeah. My wife and I wrote a book, a story, an article about love medicine. Oh, this is good to be on. These are my slides. These are my this is my PowerPoint. Anyway, you can see that we were interested in this concept of love medicine for the dying, particularly because if you can't do anything else, you can jolly well love your patients or your whoever is important to you in your life. And so I kind of like to use that word love because it doesn't get used much. And I know as a teenage boy, I would not have used it. I would not have used it, certainly. And interestingly, just to follow up briefly on that, going back to boarding school the day after hearing my mother had died, I had no conversation with anybody, adult or child, about my loss. Never discussed. It's not extraordinary. I think it's extraordinary. So don't let that happen. It's not necessary. It may not be important to use a lot of words around people who are dying, but it is important to be around them and not to walk past a ward, a room where a patient is dying because, well, there's nothing we can do. That's not the case. There is never, ever occasion to say there's nothing we can do. It's not appropriate. Do you want to say anything else at the moment, Manisha? You want to read any more chats since that seems to be.
No, I think Kaylin just put the article in the chat so that people could have a link to it. But I do see that Elizabeth's hand is up.
Hello, Elizabeth. Where are you? Oh, hi, Elizabeth.
Hi, I'm here.
Oh, yes. Like
so my particular area of practice is I treat patients with chronic psychosis and street entrenchment substance use disorders, often a population that is deeply unloved and perceived as unlovable by society at large. Often even there's been significant disruptions and deficits of love in their own developmental trajectory, their own upbringing. And I was just talking about this with one of my medical students today, is that um, I find that a very powerful tool in this type of work, where there are no cures, there is sort of symptom management and often very sad outcomes. And yet, a very powerful tool is um, I use the term positive regard, but one could think of that as a facet of love, is that the patients who are often interpersonally very difficult, often very unpleasant actually to interact with, they're often violent, they're often, it's not fun sometimes. And yet there are other humans. There are people who we can find something positive and a common humanity with them. And I know that allowing them to see that I like them and that I have a positive regard for them, even if I'm not in favor of whatever specific behavior they're doing in that moment, or that's causing ruckus in the community or whatever. That is a very powerful therapeutic tool that allows these long-term treatment relationships with very, very in very difficult circumstances and with difficult patients. And I think that it both improves their quality of life to have somebody who sees them positively. And it also makes my work sustainable and makes it something that I love to do. I love my job and I love what I do. And when I stop enjoying spending time with my patients, I know that it's time for me to take a step back and do some reflection and readjust my kind of own boundaries and strategies, because the baseline of what we do of looking after patients should be to view them with love and compassion.
Brilliant. Wow. Gosh, I don't need to say anything. It's wonderful. Thank you. And I'm so glad to hear that you love your work. It's tremendously important. And thank you for doing it. And you're clearly teaching also. You're teaching medical students, right? Yes. Oh, excellent. Wow. They're lucky to have you. Pamela Brett McLean. I haven't seen you for a long time. Hi. I'm glad you're still there and you're still teaching. What do you do?
Yes. I'm still here at the University of Alberta, teaching, including teaching in China right now with a partnership that we have in Wenzhou. But no, it's wonderful to see you and to see everybody gathered here. And
Are you coming from Wenzhou, China right now?
no, I'm here in Edmonton right now.
Okay.
Yes, yes. And I see another hand, and I think Alexandra wants to
Hi,
connect. So
Alexandra.
yes.
Where are you?
Yes, I'm here.
Oh, there you are. Oh,
Yes, I have been a family doctor for 30 years.
yes.
I retired from family medicine, but a significant thing about family medicine is that you follow people for decades. And when you talk about love medicine, I really think about family medicine. That is love medicine. You see people, these are the kids who want to dress up as you for Halloween, like you, and that you're included in their play, and that you get pictures and you are part of their circle, and the love is really, really powerful. It's not just for the older and the dying. It's hugs, it's touch, it's a touch on the shoulder. It's just being there, even if it's a phone call. I really think my 30 years was love. It was love medicine. Yeah, I think that is such a powerful tonic that we give. It's really is this tonic of, like, I would say a lot of the times they would go to a specialist, they would get put on drugs that I had taken them off because they didn't want to take them anymore, and they would come back to me and we'd take them off again. They'd still do very well, but the trust and love is wrapped up together.
Perfect. Perfect. Wow. These are, my goodness. As I said, I don't need to work too hard tonight. You guys have got lots of wonderful things to say. And you used the word touch, Alexandra, and that happened to be my next question, my next word, I should say. And I'll just read what I said here. A simple way we can express our love is through touch, as you said, a hand on the shoulder, physical, emotional, spiritual. Anybody know Louise Erdrich's work? Well, Louise Erdrich, I think you're nodding, Pamela. Is that right? Yeah. Yes. Okay. Well, yeah. Well, I'm thinking about the book Love Medicine. Have you read that?
It's been a while. I'm
Okay.
just looking it up, but I recall it. Yes.
Love Medicine. Yeah, yeah, I'm going to quote from it briefly about love, about touch, I should say, about touch. There's a Chippewa, I think that's how do you pronounce it? Chippewa, is that right? I think Chippewa. Anyway, Lipsha Morrissey is a character in one of Louise Erdrich. By the way, she's a novelist. She lives in Minnesota with her daughters, but she's North Carolina. I think she originally from North Dakota. She creates this character, Lipsha Morrissey, who is a school dropout. He lived on a North Dakota reservation, and he spoke of his healing power in these words. I got the touch. I got secrets in my hands. The medicine flows out of me, the touch. I run my fingers up the maps of those rivers of veins, or I knock very gently above their hearts, or I make a circling motion on their stomachs, and it helps them. They feel much better. He was a shaman. That's what he was. And now we know if we were to use the words of biomedicine, that what is happening when you touch somebody, or if you touch with love, and don't be hesitant to touch. Of course, sometimes you may feel the need. I felt with we have a lot of Syrian people here, and I wanted to touch a Syrian woman of middle years, and I realized perhaps that wouldn't be appropriate. And so I asked her permission and explained who I was, and I was just wanting to just hold her hand, and she had some problems that she wanted to share. So it was appropriate, but it may not always be. However, I like to think that touch is as a really healing, it's a therapeutic thing. In biomedicine terms, what's happening, I think, if we get a kind of a reward from touching as well as being touched, if you will, what's happening is that we're getting our endorphins, dopamine, oxytocin. Those words are so beautiful, and they are shooting up our mesocortico-limbic highways instantly. That's our reward system. It's often called the reward system. Look it up. It's a nice thought. And we have this power, this, if you will, biochemical power within us. But that's not what I'm going to dwell on tonight. I just wanted to point out that biomedicine understands these words. It doesn't always use them as often as we might. The next thing, and so, well, and I just finished with Louise Erdrich, Erdrich. Louise said about physical and spiritual touch. It's a sacred shamanic art that binds people and culture. Notice people. It binds people and cultures together by directing loving energy into the physical world. So it's very much about, well, the next words that I have are illness and wellness. Now, maybe I can ask somebody who's hiding. Frank, are you willing to turn on so I can see you? Frank Johnson, I've got three Frank Johnsons. I don't know which one. Oh, four. I got four Frank Johnsons. No? Yes? No? Okay. It's all right. You don't have to. Of course you don't. But what I'll ask, maybe I could ask Amelia, the question I have for you. Can you take let's see. Can you take the word illness and substitute the letters WE for I? What do you get?
I'm sorry, you said.
Try again. All right, I'll say it again.
Yes.
So here we are. We have here the word illness.
Illness. Mhm.
Take the letter I and substitute WE, and what do you get?
Wellness.
Yes, it's a nice thing. Nice thing. So wellness, yes, that's nice to be able to do that so simply because it's about I and we. So that's why I wanted to emphasize that I think that we're connected. This is the most important thing. Isolation today, I doubt that many of you could make a strong argument against this. Isolation is a major scourge in our lives, in our collective lives. Therefore, all I know is to say that we better get together. We better really explore each other. And this is a wonderful, wonderful diversity of people. And I'm sure you probably all know each other. I don't know that, but I'm assuming it. And I think that it wasn't taught to me. I know, in fact, quite the opposite. When I was in medical school, going back to those early days, all I know is that you were discouraged from laying on of hands. Laying on of hands, so touching was not encouraged. And yet, it seems to me that is perhaps one of the most important things that we can do is to touch, or at least in some form, whether it be physical, emotional, spiritual. In fact, my next word, practice, I wrote this. Practice is a good word to use in practicing medicine. Practicing medicine, it takes practice to become a good doctor. It takes a long time. For the first 10 years of practice, I used my hands. What did I use my hands for? Diagnosis. So I would feel, not particularly kindly perhaps, just trying to separate the liver from the spleen, from the kidney, from the, Well, then I learned that it's actually perfectly legitimate to lay your hands on patients or people, if you will, in general, to help with their healing. I hope that's acceptable to you. What Lipsha Morrissey calls simply helping people feel better, often in a very lasting way. So let's see, who hasn't spoken? All of you, actually. Well, Kaylin, I'll come to you, if I may, because you're the only medical student that I can see at this moment. Is that right? We don't have any other medical students here? No reason.
I'm also a medical student.
Oh, oh, hi. Hi,
Hello.
Gail. Is that right? Oh, Gail, Kale.
Kale, yeah.
Oh, hi. Good. Good to see you. Have you
Hi
been,
there.
or you just arrived?
No, I've just been wandering around my home and listening.
Oh, okay, good. You're at home. You're all at home, probably. So, Kale, what do you have to say so far? Anything you want to say or ask or complain? Compliments are good too. Complaints are okay.
I was thinking about touch, and that's such a like you mentioned when you were in medical school, that was kind of taught against laying hands on a patient. And I feel in our training, we're taught in any kind of exam, like we're taught about touch very delicately, I guess. And yet, I feel that there's such power and such potential in that kind of interaction, and yet it's undervalued, I think. And
Yeah.
when learning, I feel like it's not something that I'm comfortable with because I don't know how.
Have you been in touch with patients so far, or are you pre-med?
I'm in medicine.
Yeah. So you
I have.
touch your patients,
Yep.
and do you touch them for diagnosis or for therapy?
Thus far, just for diagnosis.
Yeah, but you know now that I'm sure you knew really already, of course, that laying on of hands, laying on, have you heard that phrase? It's rather a spiritual phrase, often used in spiritual traditions, laying on of hands. But you know, we have these, well, I'll just say this is a nice idea, which you, well, I'm sure many have heard. We have, well, our faces really have all our sensory equipment. We have 2 eyes, 2 nostrils, 2 ears, 1 mouth. We, as doctors anyway, should use them in that proportion, right? So we have 2 eyes, we have 2 nostrils, we have 2 ears, and 1 mouth, and we should use them in that proportion. In other words, let's shut up and listen. That's what I'm really saying, if I could put it rather crudely. Yeah, helpful. But touch without words, without having to fill the air with noise, is a very, very, very therapeutic and valuable thing to do. I'm just passing that along, and you may find an opportunity to touch a person without worrying about what's wrong with them or figuring it out. I know so far you said, I'm in medicine, and oh, you've gone. Oh, there you are. So anyway, anything you want to say to that? Well, I'll just say, when I was in America, which I was for 30 odd years, I found American men were quite good about hugging. I mean, good, that's not the right word. I shouldn't make a judgment like that. But men hugged each other rather freely, actually. It's a troubled country, that America, isn't it, right now? I'm very glad I'm in Canada. But I did find, I've been here nearly 20 years, and I did find when I came to Canada that hugging wasn't always okay. So in Britain, men didn't hug each other, not in my day anyway. Then I went to America and I found men were very willing and enjoyed hugging. And then there were the Canadians. Oh, well, Canadians didn't seem to be quite as willing to hug, at least the Canadian men. So I just, that's an interesting thing. I don't know what, it says something about culture. But anyway, what I was going to say is that I practiced. So after I got a little more comfortable with Canadian, I decided to start hugging men, and they all responded. Well, what I learned to do, men tend to do this. Hold on for about, this is the male hug. Hold on tight, maybe a little clap on the shoulders or whatever. That's that. Well, what I did, when I started to, once I got them in my arms, then I would hang on to them. Oh, God, if you hang on for more than 3 minutes, I don't know whether you women can understand this, but when we men hug, we don't normally hang on for too long. And I learned, oh, this is fun. And of course, we got lots of giggles and lots of laughter. But you know what? That was mostly embarrassment. Embarrassment is a nuisance. It's more a nuisance than anything. You better get over your embarrassment, if you have any. Women are better at that than men, I would judge. So it's good to see you, Cale. Thank you. Are there any other men in hiding away? Shane, maybe? I'll let you hide. It's all right. Let me see what other. Okay, I want to say something about how are we doing? Oh God, it's 10 to 8. Have we got to stop at 8 o'clock, right? Is that right, Manisha? Or Kaylin?
Officially, we're at an hour, but if you would like to go a few minutes over time, I'm very happy with that.
Well, I can go on as long as you like, but how many hours do you have? Just keep going.
I would say for time purposes, we should probably limit at 90 minutes at most, but
Oh, I do respect very much, an hour is what you committed, and if you're ready to leave at an hour, it's absolutely fine. I fully understood that. Two things I learned about teaching. First was that I found that in these large lecture halls, that the people, and they were mostly, I have to say, they were mostly the male medical student, or the male students, shall we say, would sit at the back, and they might be giggling and they'd be chatting away. One little trick I found is I would teach from the back. In other words, if there were 50 or 100 people in the room, I would go to the back and teach from the back. Made it more difficult for the people sitting in the back row to not pay attention. It's a useful trick. Anyway, that was one thing I learned about teaching. I learned something else, but I've forgotten it. Doesn't matter. Okay, I'm going to come to a little bit on this. Did I use that phrase, masterful inactivity? Have you heard that, Kaylin? Does it mean anything to you?
No, when you just mentioned it in the beginning of the talk, that's the first time I've heard that phrase.
Okay. What do you think it might mean?
It sounds like drawing like meaning or finding importance in not doing things.
Right. Good. We don't have to do things, right? Doing, do, all that stuff, What was that, Frank Sinatra? Do. Yeah. We just have to be. And just hanging with patients. I happen to have worked with dying patients a lot, young people. And one thing I learned is there wasn't much you could say, there wasn't much you could do, but you could be there. And that's what I found really what I'll call masterful inactivity. My example, I've defined it as giving loving attention to your patients. Extensive testing can be very expensive and can do a lot more harm than good. Oft repeated CAT scans can cause cancer many years later, perhaps from cumulative irradiation and so forth. But there's not much harmful in just being with people. At least that's an overstatement, perhaps. But I would say that one of the first things that I think doctors learn, the Hippocratic Oath, primum non nocere, oh, more Latin, oh gosh, lovely. Primum non nocere, first do no harm. Well, that's, it's hard to do nothing. I had a patient who was living in unhealthy circumstances, and I brought them into the hospital, and I told the residents, we're not going to do anything for this. She was a 14, 15-year-old girl, living very, very, unfortunately, not good circumstances at all. I brought her in just simply to give her some fresh air, some healthy food, some warmth, some comfort, some safety. And they may become immeasurably healthy. It really helps to be able to do nothing but simply offer situations in which a person is feeling, oh, I feel safe, I feel I've well slept and so forth. That's not a small thing. I have a poem. I said I'd ask Manisha and Kaylin to provide a poem, but I'll offer one. This is a short one. I call it Self-Share, and I better explain what it's about a little bit. I had a patient, again, a teenage girl, tragically. She had cancer and she was dying. She was on a ventilator, so she couldn't talk. She had a little notepad in front of her and she could scribble because she was conscious. She did not want to be sedated. Patients have a right to not be sedated. And and I've met a few young people, very courageous, who said, I want to be aware, who knew they were dying. I don't want to be drugged. Doctor, I also had a patient who said to me after I'd told him that his cancer was not going to get better, I was likely to, in fact, that's the way I put it, because he was kind of a whimsical chap. So I said to him, I think I'm going to live longer than you. Oh, he said, Doc, lighten up, would you? Lighten up. We don't need serious doctors around here. Solemn doctors, the word. Solemn doctors around here. He was happy to kind of, not exactly joke, but just keep it light. Levity. Children, oh, this is a useful idea. Children, which is why I'm so glad to have spent all my life with children, or most of my working life. Children, like angels, can fly. They take them because they take themselves lightly. So that word lightness, levity, nice, levity. Anyway, let me just say something about this poem. Okay, so she's there. So she asked me to stay with her. Well, I didn't know how long she was going to be. She knew she was dying, and she actually lived for 36 hours, and I stayed with her. I didn't do anything except be with her and hold her hand. And she had the ventilator and all that equipment of ICU equipment, but I was able to just be close to her. And I only left for bathroom breaks. The nurses brought me sandwiches and I don't know, tea, I suppose. And here was the poem. So I thought of it, what I thought was her ventilator prevented her free speech, free breathing, but she was breathing in and out. It was her breath and my breath, and we were very close. So there was that sense of cells, that sense of cells, gosh, that sense of cells shedding. So we were sharing our breaths, really. Cell shed. I lean in among the plastic tubes besetting you. My breath voluntary, yours coerced. Our cells mingle, each with the others. A spindrift of air, water, ice between our mouths. You going, dying, take my life to rest. I living, left, draw in, exhale your seed. So our seed, our breath, goes, who knows, as far as we know, all over the world. Nothing limits breath, nothing. So our seed, the seeds of our breath go out in the world. So I think about that, and I think about the importance of realizing the connection that we have with each other. We're nothing, it's great. If I was very, very lucky to go to medical school, I didn't have to pay any scholarships. I mean, I didn't have to pay any tuition because there were scholarships available in those days. And I was very, very blessed to have a grandma who helped a little bit, helped my mummy. My mummy didn't have any money. So the opportunity for me to go to medical school was really I was very blessed. It was very fortuitous. But I did get to know people as human beings and never doubted that they were no better or worse than me in any sense at all. What happened to that? I'm going to change the subject a second. Pamela, can I ask you, what's that, the poet that at University of Alberta, and what's her name? I've forgotten. She may have retired now. Do you know who I mean?
Are you thinking Shirley Service?
Yes.
Say her name again.
Shirley Service?
Yes, that's right. Yeah, Service. Is she still about? You obviously know her.
She's retired now. I think it was my first or second year of medical school that it was her last year.
Okay. Yeah. Okay. Well, so Pamela, you obviously knew her. I think you must have, because I met her when we came out. Dorothy and I came out, and we met you.
Yes.
And met. Yeah. Okay.
I see her from time to time, so I will be sure
Oh, good.
to
Well, please
say
do.
hello to her
Yeah.
from you.
Yeah. Excellent.
Yes.
Are you writing poetry?
Not as much as I should.
Oh, oh, should. Don't should on yourself. You don't need.
Okay. I wish I was writing more, but
Oh,
we have our Healers Art session tomorrow,
oh,
which will focus on poetry.
oh, I'd
And
love to join you.
several of the students here might recall that. So yeah.
Do you have a poem, Manisha? I asked her ahead of time.
I do have one that I found from
good.
medical school that I can read.
Oh, good. Please do.
So this is called Peace, Peace. The skin on her face was smooth and supple, the crevices of her past watermarked flesh. She waited anxiously in the blue hospital smock, feet embraced by well-worn hiking boots, head adorned by a red pom-pom. Her young son stood next to her, praying for time, miracles, and negative margins. As the woman lay down on the bed, the shakes began. The sun translated, the doctor moved, each breath and action planned and then pursued. The doctor smiled and rejoiced. The drain could come out. With just a few snips, the sutures would split. She was free of this foreign body, this intruder supposed to assist. But the woman remained terrorized, trembling with no end in sight. The woman spoke little English, just good morning and thank you. These words she repeated. Like clockwork, they came even. Every few seconds, she would repeat it again, reinstating her presence, even if language wasn't a friend. When the drain was pulled out, she shivered once more. Though the tube was no longer inside, the tube was nothing compared to what her body could hide. Part of her breast was often some lab, excised by this doctor with her own 2 hands. And so she continued to tremble, the tribute in this game of hide and seek. Had the doctor succeeded, or was there more left unseen? Luckily enough, all the culprits had been found. The good doctor rejoiced the hider had been found. And excised it was, every little piece, and with that good news the shakes ceased. The sturdy woman with her little red hat let go of a tear, and it fell flat onto the ground upon which she would walk alongside her peace. Her peace.
Thank you. Wow. Powerful. I'm aware it's after 8. I mean, after 5 for you, right? So if you need to leave, please. Don't feel, I mean, I can just keep talking. I have a couple more words I want to use, but if you need to, please. I know you're busy people. Me, I'm an idle retiree, as they say, whatever that means. It means people don't pay me anymore. Anyway, let's see. I'm going to keep going for a little bit, and then I'll maybe open it up a little bit more. I have the words art and heart. It's no coincidence that we use the word art to describe creating works of beauty, visual, musical, literary, theatrical, and we use the same word to practice the art of medicine. The art of medicine requires many things. It requires time. And this is perhaps the most useful thing I can say today. Medicine requires time, practice, connection, relationship, empathy, humor, touch. All those things to me are so important. The Lancet is a pretty prestigious medical journal, and bless their heart, they finally caught up and they put out a series of articles on art and healing. The Lancet, it's a British journal, but it's pretty prestigious, very biomedical. But now they are talking about art. They're talking about art and healing. I like the word creativity. I like the word creative intelligence. They just showed us, I'll just quickly tell you this. They showed a series of photographs of art and healing just in the last issue. And I think these are all self-explanatory. These are the photographs. There was a photograph of clowning in a Turkish refugee camp. There was blood donation going on in an art museum. Can you imagine? Blood donation in an art museum? That's a nice idea, isn't it? Puppetry, to teach about difficult things, particularly about sexually transmitted diseases. Puppetry is a very useful way to be able to talk to people when it's a difficult conversation. Theatrical performances in prisons. I had a very good friend, professor of theater at the University of Florida. He used to work using theater in prison. I'm not going to describe any of these beyond that. Dancing with patients with Parkinson's disease, as I expect you all know, has been very effective as a form of treatment. The AIDS memorial quilt. The AIDS memorial quilt is probably one of the very earliest examples, powerful examples of healing through art. And any of you are not familiar, and I'm sure that's very few of you, but perhaps if you're not, do look up the AIDS memorial quilt. I think it goes back to something like 76 or something like that, a long time ago. Then murals, and probably in your hospital, I can't remember, but I'm sure murals have become very popular as hospital wayfinders. So look for the picture of the group of dogs or something, whatever it is, or the little child who's being held by her mum. These kind of these pictures on the walls at Shands Hospital, the University of Florida. We put art all over the walls, and it was used as wayfinding, as a way, because hospitals are pretty scary and confusing places, aren't they, to find your way around. Self photographs by patients with cancer. I would give photographs. I would give their cameras to patients with cancer and have them take photographs of each other, of themselves, all kinds of things. Amazing what photography can capture. And the last one I loved was mime artists. Mime artists as crossing guards. And crossing guards in the busy street, mimes showing when people, this is a miming after all in a way. It's great. These are wonderful photographs. And that's in the Lancet just recently. Creativity. I've got lots more. I haven't even touched on palliation. Art, I think, well, I will just say that I will say something about art, I think, just briefly. In order to counter the isolation that maybe most patients feel, that in 1990, which is 35 years ago, for God's sake, I began to bring artists. I snuck them in. I brought them into the hospital. Dancers, musicians, poets, painters, you name it. I didn't ask any permission. I did not. Into my hospital's intensive care unit where I was working, our bone marrow transplant unit, isolation units at the University of Florida, because I had this instinct. I didn't have any data, but I had an instinct that these artists could help our patients in their healing. They could help build creative, trusting relationships, perhaps draw out the artist in these patients. Because, of course, everybody says, I'm not an artist. I mean, all the patients seem to say that. It's an interesting thing, but we're all artists, of course. We all made art as young ones, and most of us seem to have forgotten. Yeah. In these 35 years since that time, we have had hundreds. And I know that you've, Pamela can tell, are you still in charge of the humanities, medical humanities? Yes, I thought you were. Yeah, good. I must look you up. Good. Wow. Well, as you know, we've had hundreds of artists in those hospital wards and clinics, and they've been paid. In the last, most of those years, they've been paid. The hospital administration party started paying them. Paying artists. Isn't that well, 35 years ago, that was an extraordinary idea. I remember the very first artists that came, they were Stuart and, what's her name? Stuart Pimsleur. Oh, well. Anyway, the Stuart Pimsleur group, they were dancers. And they came and I asked them, would you perform for us? This is a big atrium, huge atrium. They were pretty scared because, hospitals are scary places. But they brought their troupe with them. There were about 8 of them, and they danced in the atrium. They just danced. They just started dancing. When noon, I remember this particularly because artists are good at starting on time. I don't seem to be very good at shutting up on time, but we'll keep at it. Anyway, so this group, Stuart Pimsleur, and his troupe, started dancing. It was absolutely wonderful. And we had patients, we had family members, we had staff, all just gathered around to see this extraordinary thing. What the heck is going on? This is 35 years ago. These were dancers. And then I knew we'd hit on something because everybody enjoyed it enormously. And the dancers, because they were dancers, quickly got into it. They said, "Oh well, nobody's stopping us. This isn't our usual setting for dancing, but it'll do." And indeed, it was a powerful experience. The dancers. So I never thought. And in fact, I think you can see right behind. You see that picture where my finger is wiggling. You see that? That's Jill Sonke. Some of you may know her. She's now at Stanford, but she was my first, almost our first hire, Jill Sonke, and she was a dancer. She doesn't dance anymore, but she may, but maybe she dances in the shower, in the kitchen, wherever. But she wouldn't dance publicly, she would say. But she's done an enormous amount of wonderful work to highlight the value of the arts in medicine and healing. Okay, let's see. I think I'm going to stop and shut up. Been going on long enough. Palliation. I think I'll stop. Okay. Anybody want to say anything? And you're still here. I see some of you anyway. That's nice of you to stay. Thank you. Kaylin, anything you want to say? Or anybody else? Have I covered any ground that's useful? I hope so. Oh.
I did want to say that this was very lovely, and I'm really grateful for everything you did say.
Thank you.
Yes. Lots of food for thought.
Oh, good. Well, I'm glad you're recording it because who knows what it'll sound like, but we'll see. At least I heard from you, many of you, which is great. I do have one more poem. Could read that. Maybe I'll do that and then I'll stop. How's that?
That'd be lovely.
All right. This is called Waiting. This is about a boy, a teenager again. Gosh, those teenagers. He died. His mummy spent the last minutes of his life with him, but not his daddy. His daddy couldn't handle it. I just call it Waiting. Dominic rests on his air bubble cot, awaiting life's flight from its earthly beat. He has wearied of searching for how to exist, of the tubes that fuse to the bag and the pump, these faceless monitors of the clock that count his mortal minutes out. We caregivers charter our critical route between a stark place and a brittle rock, while his body lays open its faltering stock in free falling spin from heart to gut, disgorging its wherewithal and prop with which we fumble to hold it up. His fathers run missing in the wood to nurse his gun and suckle his guilt, while his mother stretches her vigil out, not letting her mind embrace it yet, beholds in his eye that guttering life that still will not douse its callow light. For what does he linger till this spark has no more tinder to keep it lit, till the organ dead conspire to draw his soul to the dark? Or will he wait till this woman who bends so close above can finally offer his spirit up? It's enough. Okay. Thank you for inviting me. Anybody want to say anything? Last words, please? I won't say any more.
It's been an honor hearing you, and
I think we're done.
I just wanted to say, I wrote it, but I wanted to tell you that you are such a healer through and through, just such an authentic spirit, and just thank you for your time. And yeah, the session was a lot more personally healing than I was expecting. So just thank you for that.
Thank you, Amelia. It's very sweet of you to say those things.
I would love to echo that. This is Alex, and I agree. I didn't realize how meaningful it would be to have someone so authentic and so life lived. Life lived. Yeah.
Thank you.
I wanted to read a couple more comments out of the chat, and then
Okay.
I would love to say my own thanks. But Susan, who's still on the call, has said, your insight is profound and your classroom is delightful. Chris, who had to step out early, was very much appreciative of this discussion as well. And Shane, who was hitchhiking off to the hospital. And on behalf of Obliquity, I just wanted to say many, many thanks for being here today. When this little workshop series started 6 years ago now, I don't think I could have ever imagined how it would have bloomed into this space. And I always feel so incredibly grateful to meet new faces and familiar faces each time we have these sessions. And it was a privilege to hear you speak. Thank you so much.